But if anyone does not know about ABC House and would like a little more information, some of you I've seen recently and have this. There are statistics from 2009 and information about our programs. So ABC House is the local child abuse assessment center, and we serve children from both Lynn and Benton counties. We are located in Lynn County, but we've been providing services to children from Benton County for about 13 years now. And we provide a large comprehensive group of services, primarily full medical exams for children with we have a doctor employed who is considered an expert in the field of child abuse. She works full-time for us and has been with the agency for 14 years. We provide digitally recorded forensic interviews, and those interviews, any child who is spoken to at ABC House in a formal manner is interviewed and recorded for a multitude of reasons, and only people who have very specific training are allowed to do those interviews, so that we know that children are suggestible and we know that they're clean, clear interviews gathering objective information. Our purpose is to provide a safe place for children to talk about what has happened to them, to provide support to families who don't know where to go. It's very intimidating to find yourself having law enforcement or DHS knock on your door and say they believe something's happened to your child. And so our job at the center is to provide this place where children and families can get the support and the direction they need, whether it's explaining to them the investigative process that law enforcement and DHS go through and how can we help them, how can we identify other needs they may have, are they in a domestic violence shelter and we can refer to CARDVA or refer out for clothing, food, housing. And then two big things that our advocate does is help link families to counselors that are easily accessible to them, that their insurance will cover. Many of our families do not have insurance for counseling and have no resources whatsoever. We have a very small amount of money and we provide counseling to as many people as we can on a part-time. We have a part-time counselor. So the services our services are the only ones in Lynn or Benton County. We've opened 509 cases last year, and I am here before you today because this is the first time we've had to ask. We are not funded with tax dollars. We do receive money from the Department of Justice that comes through what we call criminal fines and assessment fees collected within each county when through the judicial system. Every county gets a small proportion of those dollars. We hold a contract with Benton County, and we have currently about $10,000 coming in donations from Benton County. And to be honest, we are looking at a 25% cut from both counties in those criminal fines dollars, which would equate in Lynn County to about $40,000 and about $25,000 to Benton County, and that is going to hit us. In addition, we bill for medical services and counseling, and as you may know, the governor is recommending a large cut to the payments to the Oregon Health Plan. Over 60% of the kids we see are on the Oregon Health Plan. We only receive 35 to 40% of what we bill currently, so we're going to be looking at some big cuts. And we've been able to make up the differences. We no longer do I see in our future that we're going to be able to do that without some help, without cutting services. These are crucial services to children and families when they are in crisis and having been abused. Not all children that we see have been abused. It's a good day in our building when we can say this child is fine. At the same time, that child came to us because there were concerns about their safety, whatever they were. So we can then help build resources to the family to continue to protect those children. We do work closely with Department of Human Services and law enforcement in particular, but we have many partner agencies. ABC House works on average every week with 10 different agencies on a daily basis. So we have a lot of services that go out on a very small staff. We have 6 full-time and 3 part-time staff put out a lot of service to our families, and I'm here today to ask you to consider to help fund the children of Corvallis. And let me tell you how I came to these figures. We pulled out the counseling and the education services that we provide and looked just at what does an assessment consist of. It consists of medical, interviewing, and advocacy, as well as the whole operation of the building. Took that, divided it, the cost of all those services, divided it by the number of cases we opened, came up with the $915 figure, then took the $80,500 that I received from Benton County, calculated what does that equal per child from Benton County, and then there is the difference. And so the $36,000 that I'm asking you for is the cost of 70 or 90 children from Corvallis, the city of Corvallis, that we provided services to last year at the cost of the difference. So that's where that came up with. And I realize that it's a large dollar figure, but if you stop and think about a child's alternative is to go to the police department for an interview and the ER for a medical exam with a doctor who's a great ER doctor, does not specialize in child abuse. That child gets about 15 minutes of their time versus our doctor. They get 2.5 hours of our doctor's time with expertise so that we can really identify the needs of that child and their safety risks and help families put themselves back together so that we can have children who can heal. It's a complex, most of the cases we see are child sex abuse, mostly because it is very, very complicated. The other second highest group is physical abuse, and that has increased over the years since Carly's Law, since Representative Gelser was instrumental in getting Carly's Law established. That increased our workload by about 130 children per year, and with no money coming with it. So we are really at a maximum. We hope we can continue to fundraise. I have just hired a fund developer who's great, but that takes a long time to put that program in place. And the last thing that I want to do is have to either limit the number of children that come through our doors or lay people off, because every single service is critical. So I'm here before you. Any questions? I know that's so quick. Yes?
Question. Is mainly the children that are coming through a situation through law enforcement?
It's kind of, it depends. Sometimes it's law enforcement alone, sometimes it's law enforcement DHS together, and sometimes DHS separately. I would say more often than not, law enforcement and DHS are there together because it's a family and there's a crime, an alleged crime. Yes.
So when a child comes there, my understanding of what you're saying, and correct me if I'm wrong, the services have been there already to be there so that they're not having to go to the hospital.
Correct. So what happens is
doing it all under one roof?
Yes, law enforcement DHS will go out, make an initial assessment, and then say, wow, this case really needs to be at ABC House. And so they call, they make an appointment. We have the medical provider. Sometimes law enforcement does the interview, sometimes DHS does, or our interviewer. It depends on the circumstances, but the goal is to have that child in that safe, neutral environment where they're not afraid to talk openly about what happened while they're reinforced, the families can get services. Then everybody comes to the building that needs to be involved, and so we're only talking to the child, hopefully minimizing to one time before they move on through the system. The goal is to minimize the number of times a child has to talk about what happens to them, because we know that can be traumatic for them. So it's to gather clear, objective information so we're not falsely accusing anybody of anything, and we know what the issues are for that child and that family. Any other questions?
We're about out of time, guys. So again, I'll just ask, we'll have teams that